and it is time for our visit with Dr. Kevin Kavanagh. He is a retired physician and founder of a national organization called Health Watch USA. Good morning, Doctor.
Good morning, Jack.
How are you today?
Doing pretty good for a Monday morning.
By now, you have no doubt learned that our governor is being quarantined or is self-quarantining along with his family.
Yes, and I think he's doing the correct thing. At least his security guards were not wearing an escalation valve on their mask, which unfortunately the president's guard was. And I think he's doing everything correct and will keep himself safe. We should follow his example.
Yep. This is more political than anything else, but the other big COVID story that I'm hearing this morning is about Dr. Fauci's words being taken with the way Dr. Fauci describes it out of context and without his permission in the latest ad for the president. Have you heard those?
I have. I haven't really looked at if it was in context or out of context, because when you start to get highly politicized, to me, that's just depressing. The scientists shouldn't be in that arena. They should be separate, looking at data, discussing among themselves differences, and coming up with a consensus on a plan to motivate America to follow. And you can't do that when you mix yourself into political races.
That's true. What else should we know about regarding COVID-19 this morning?
Well, I think one of the big things is that declaration which was mentioned on Friday. And that to me was kind of distressing. It's mixed messaging. They are a group of scientists. Personally, I wouldn't characterize them as mainstream. They're certainly not part of an infectious disease society such as APEC or the Association of Professionals in Infection Control or the CDC or NIH, but they're touting the old narrative of just let this virus go, herd immunity, shelter those who are at risk, and all will be well. And we have heard this for months and months and months now. If you can remember, back in early June, we heard it about California, that antibody levels there were great. And well, we later found out they weren't, and California spiked in late January and early August. We also heard that even recently regarding New York City. There was a little spat between Dr. Fauci and one of the U.S. senators regarding New York, that they've reached herd immunity. And Dr. Fauci said, no, they didn't. Well, now they're closing down schools. And Sweden, we keep hearing about Sweden. Well, first of all, Sweden did a lot of public health measures that were followed to a greater extent than what they were followed here in the United States, such as social distancing, working at home. They closed high schools, they closed universities, they closed down sporting events. They did a lot. And unfortunately, the virus is resurging in Sweden. So it didn't work there. The only place that has had a strategy that has worked has been in Southeast Asia. When you look at Taiwan, you look at South Korea, you look at New Zealand. In South Korea, they've had under 500 deaths. And if you equate that with the United States, we would have approximately 4,000. And they used masks, social distancing, hand hygiene, and abundance of testing. And those are the strategies I think we need to do. South Korea did not close down their economy. They didn't have to. These are the strategies that, by the way, Senator McConnell has been advocating. And he is very worried about the directions of some people and their messaging. So I really would really beg the public to let's follow these basic public health strategies. And as far as being able to shelter those that are at high risk, that's impossible to do. There's too many people at high risk. It's about a third of the adult population. And we've got multi-generational families. So it's a false narrative. And the other thing that was interesting in this declaration, I think, is really not realizing how pandemics have transformed society. There was a call of letting people go back to work. Well, people don't necessarily want to do that. Microsoft is just the latest company that stated their working at home policies are going to be permanent if workers want to opt into that. And we are seeing this in Fortune 500 companies. Very commonly, this is occurring because productivity is up, people are happier, and they're either going to come into work just a few days a week, or possibly just staying at home. So you're going to see a transformation. People are ordering online now. They may continue to order online. It's more convenient. It really is something that I think is easier to do, especially if you're elderly or it's hard for you to get around. So pandemics are transformative. Things are not going to go back to the way that they were because we are learning how to live better.
Not going to go back to the way that they were because we are learning how to live better.
All right, Dr. Kevin Kavanagh, and we will give you Wednesday off and get back with you on Friday morning.
All right, thank you, sir.
Dr. Kevin Kavanagh.